Today we will be discussing on how to inject insulin. A 63-year-old patient named Oscar Goldberg is here today with his wife Fran and has recently been admitted with type 2 diabetes. He has been started on basal insulin and requires teaching on what it is and how to draw up and inject insulin by using a vial and a syringe. Let's take a look at them now.
Look at this, Oscar. Johnny showed me how to use the Facebook on my new iPhone yesterday. Isn't that nifty? Take a look at that.
Good afternoon, Mr. and Mrs. Goldberg. My name is Allie and I'll be your nurse today.
Hello, dear.
Hi, how are you guys doing?
Oh, not very good. My diabetes has progressed and I have to start using insulin.
You sound very frustrated, Mr. Goldberg.
Pardon?
Oscar, she said you sound very frustrated.
Oh, yeah, I am. I just want to keep eating my regular food without changing anything.
I understand this must be very difficult for you to adjust.
I'm telling you to knock it off with all this junk.
Fran, now is not the time.
Actually, she has a point. Diet is a very important aspect of controlling the effects of type 2 diabetes.
Oh, I know. I've been through this many times.
I know. However, I've asked a registered dietitian to come speak with you later for a refresher on the importance of eating a proper diet. Anyways, the purpose of today is to teach you about monitoring your own blood glucose levels, as well as the insulin you've been prescribed and how you will self-administer it.
Okay, I suppose this could be important.
Yes, Oscar. Now actually listen for once in your life. This is important for your health.
Yes, the process of administering your own insulin is vital to ensuring a long and healthy life.
What does insulin do?
Insulin is needed when a patient's body does not produce enough insulin to meet specific metabolic needs, and when the combination of nutritional therapy and exercise cannot maintain the satisfactory blood glucose level.
Okay, I understand. What should my blood glucose level be?
The optimal range for blood glucose level is 4 to 7 millimoles per liter.
Well, my blood is normally at 12 millimoles per liter, and I do not feel any different from the day I was single and free.
Oscar?
Well, there are many risks to being hyperglycemic for long periods of time, such as sensory nerve damage, as well as retinal detachment, which can cause blindness.
Oh, I had no idea. Okay, I'm happy you're here to teach me.
Finally, Oscar, maybe if you would have learned this sooner, we wouldn't be here.
Well, what matters is that you are here now. Let's talk about the type of insulin you have been prescribed, which is Levemir. This is a long-acting insulin that is released steadily and continuously over 24 hours. It may be used once a day and is given subcutaneously at bedtime.
Does that mean I have to give myself a needle every day?
Yes, Oscar. Like I said, you shouldn't have eaten all those Twinkies.
Yes, but insulin does have to be given through an injection.
Can't I just take a pill?
Insulin is inactivated by gastric juices produced by the stomach, so it cannot be taken orally. In a minute, I will be showing you how to inject the insulin, but first, can you tell me what you have learned so far?
Yes, I've learned that insulin is needed to control my blood glucose so I don't become sick.
Do either of you have any questions before we get started on learning how to draw up and inject the insulin?
I don't think so.
Okay,
Due to unforeseen circumstances, we have now had to change location. Please now watch as we show Nurse Allie teach Fran and Oscar how to administer insulin.
I'm going to tell you about the various insulin injection sites. There are a few different sites to choose from. The fastest insulin injection site is the abdomen, followed by the arms, thighs, and the buttocks. You must ensure you rotate injection sites every time. To do this, you can think of each site as a square on a checkerboard, which should be approximately 2.5 centimeters from the previous site.
Why?
Well, there is a risk it can produce lumps and dents in the skin, which will cause variability in insulin absorption. I have some practice vials and needles here, which we can practice injecting on these pads. Now I will tell you about the various sites for insulin injection. There are a few different sites to choose from. The abdomen is the fastest injection site, followed by the arms, thighs, and buttocks. You must ensure you rotate injection sites every time. To do this, you can think of each site as a square on a checkerboard, which should be approximately 2.5 centimeters away from the previous site. For you, Oscar, we will be choosing the abdomen as your injection site.
Why do I need to rotate sites?
Well, there is a risk it can produce lumps and dents in the skin, which will cause variability in insulin absorption. I have some practice vials and needles here, which we can practice injecting on these pads. Mrs. Goldberg, I would like you to practice with us, so that you will be able to give Oscar his insulin in the event that he cannot.
Okay, I'm sure I'll be the one doing it anyway, and I don't want to miss a chance to stab him.
Okay, well, I will teach you the proper technique, as stabbing him would not quite be appropriate. For the abdomen, let's test to see if we can grasp 5 centimeters of tissue.
Oh, there's definitely more than 5 centimeters here.
Okay, well, that means we will inject into your abdomen at a 90-degree angle instead of a 45-degree angle.
Okay, that sounds easy enough.
Yes. Well, first, before we start practicing injecting, I will teach you how to draw up the insulin from a vial.
Oh, great, another step.
I understand this may sound like an extensive process. However, after we do a few practice runs, I think you will find the process is much simpler than it sounds. Now that I have everything all set up, let's go perform hand hygiene. Now that we have performed hand hygiene, we are going to check the insulin to make sure it is the correct type.
Okay.
And also that it has not expired.
Yes.
It is also important before every injection to check the vial to make sure there has been no clumping or changes in clarity.
Okay.
It is also very important that we clean the top of the vial to ensure that there are no potential contaminants or bacteria. Now that we have done that, I will tell you a little bit about our needles. So this is the needle we are going to be using to draw up the insulin.
Okay.
So this is a 27 or 28 gauge, depending on what you buy, which is just small and is only about 1/2 inch.
Okay.
These are also measured in units, which is different than normal medication, so that is specific for insulin. So now I can demonstrate first, and you guys can demonstrate after if you'd like. So just to get it going, we can pull the cap off the plunger. You can do this part with me if you like, and I'm just going to pull on the plunger a few times just to ensure, because it gets a little sticky the first couple times, so you want to do this just to be accurate.
Okay.
Alright, so now we'll be pulling the plunger down till the line is at the same line for the number of insulin that we'll be withdrawing out of the vial, which is 12 units.
Okay.
So there you can see I have drawn 12 units of air into my syringe. So now we'll be injecting this air into the vial, which we have already previously cleaned.
Okay, why are we injecting air into the vial?
So we're doing this just to maintain a balanced pressure within the vial.
Okay.
So we're ensuring we enter in the same amount of air that we draw out, so everything just stays the same within the vial. So now I'll remove my cap. You can just leave your cap on for now. So that will be the needle that we'll be using. So just a little, it's about 1/2 inch.
Okay.
So now we can go ahead and inject that air into the vial. Now once we've done that, we'll just flip the vial upside down. And we can just hang on there. And then we will slowly withdraw the insulin. All right. So you can see there, I've withdrawn 12 units of my insulin. And then if you have any bubbles, you just need to give that syringe a little flick.
Okay.
And if they're not coming out, just give it a little whack with your pencil.
Okay. Why does it matter if there are any air bubbles?
Well, the air bubbles within the syringe are taking up space that should be insulin. This could lead to an incorrect dose. So once the bubbles have been removed, which we removed them already, I can now withdraw the syringe from the vial. So sometimes the easier way to do this is really to just pull the vial off of the needle.
Okay.
Now, since we're not quite ready to inject, we can just put the cap on our needle. So the safest way to do this is just slide it in there, and once the needle has been covered, then you can pick up the cap. So this ensures we get no little pokes. So now that we're done with that, for hospital setting purposes, we're going to clean the injection site with an alcohol swab. However, this site does not need to be cleansed at home unless your site were to be visibly soiled.
Okay.
So to clean the injection site, we can just take our little antiseptic swab. And we're just going to clean here from the inside out, just round circles.
Okay.
All right.
And this will be on my abdomen?
Yes, this would be on the abdomen.
Okay.
Do we wait until it dries, or do we use it right away?
You should wait until the antiseptic has dried, yes.
Oh,
Okay.
Yeah. So maybe if you have some other preparations, we could have done this at the start.
Oh, I see.
And then you wouldn't have to wait for the site to dry.
Okay.
So now that the site has dried, we can inject the insulin.
Okay.
So the best way to do this with the syringe is you're just going to want to hold it similar to, like, say, a dart or a pencil. And then if you just give, like, a quick flick of the wrist, like, straight down, it'll just go in nice and easy.
Should we go straight or at an angle?
Yes, we're going to want to go straight into a 90-degree angle.
Okay.
So now, once the insulin has been injected, we're going to want to leave the needle in place within the skin for 10 seconds. And this will ensure that all the insulin has been injected into the site, and it'll also prevent leakage. So sometimes you will know, like, if you pulled out the needle too soon, you will see the insulin almost, like, bubbling back out of the site, which you will see on these injection pads. They get kind of full, so lots of times the Practi insulin will come back out.
Okay.
However, at home, you don't want that, and unfortunately, if that happens, we're unsure of the dose that has been given. So we can't give an extra dose. We just kind of have to test blood glucose levels from there.
Okay.
And after you've given the dose, you may apply just a dry cotton ball to the site after you withdraw the needle. So I will show you the technique to give. So we're just going to pull the cap off. And once again, yes, just hold it similar to a dart. Then we're going to give it right in our injection site we have chosen, and just quick flick and down. And then you're going to hold the needle in place to assume there's no wiggling or anything like that. And then slowly, but stably, just insert the insulin. Now we will wait 10 seconds.
Okay.
And then we'll withdraw the insulin. Now I'm going to use an alcohol swab for today because when I withdraw this, it's going to squirt out back at us.
Oh.
But at home purposes, you would not need to do this.
Okay.
And now I'm going to recap the needle because we do not have a sharps container directly with us. But at home, you're going to want to purchase your own sharps container, which means purchase from the drugstore, or if not, you can use like a 4-liter milk jug. And then you wouldn't even have to recap this because that promotes like the potential for a needle stick. So the safest way is just to put it directly in the sharps container. However, today we will have to recap the needle. So again, that is just a quick little insert into the and then we can dispose of the needle in the sharps container from there.
Okay. Great.
With Nurse Ellie's supervision, the Goldbergs have injected the correct amount of air into the vial and withdrawn the correct amounts of insulin into the syringe. Now they are currently practicing injections on the provided pads.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.